so I'm Megan Bory and I'm going to be doing a Minibag IV hanging today, and in order to do that I need to check the healthcare provider's orders, the patient's history of allergies, and pertinent lab values, and then I also check the correct medicine, the dose, the route, and the frequency of the medicine. So I'm going to be over here giving Rocephin. Rocephin, its purpose is an anti-infective. Its action is to bind to the cell wall, causing cell death. Side effects are seizure, headache, diarrhea, nausea, vomiting, Stevens-Johnson syndrome, rash, urticaria, bleeding, and anaphylaxis. And the correct dosage would be 1 to 2 grams, or the recommended dosage is 1 to 2 grams over 12 hours. And then important lab values to look out for would be ALT, AST, bun, creatinine, and a complete blood cell count. The infusion time of this medicine is going to be 2 grams of Rocephin over 30 minutes in a 100 cc milliliter bag. And the nursing implication would be to assess for infection at the beginning. Before initiating therapy, obtain history to determine previous use and reactions to penicillin. Obtain specimen for culture and sensitivity before the therapy, and observe for signs of anaphylaxis, and discontinue the drug immediately, and notify a healthcare provider if anaphylaxis did occur. Keep epinephrine on side, and then monitor for bowel sounds. And contraindications would be: do not give this drug to patients that have an allergy to penicillin or cephalosporins, or they're hypersensitive to it. And use or be extra cautious giving this to patients that have renal and hepatic impairment. So ready to calculate the drug. I'm getting 33 drops. We all good? Okay. So that's our drug. And the doctor wants us to give 2 grams. So I'm going to check the bottle of Rocephin. It's intact and in date. It's not expired. Okay, I'm going to clean it off using aseptic technique. Alright, and then I'm going to draw up Rocephin. And I'm going to have another nurse notify or check the dosage of this to make sure it's correct.
It's good.
Okay. Alright, I'm going to assemble all my equipment. Assemble all my equipment. And then I'm going to grab a 100 cc bag or milliliter bag. This is in date and intact, and it's very compatible with the drug I'm giving. So I'm just going to clean the port of it with a new alcohol prep pad. Take off the Christmas tree needle, insert the medicine. Alright, and it's inserted in the bag. And then I'm going to safely mix up the medicine as well. And then I'm going to date the I'm going to apply a medication label to the bag. I'm going to put the patient's name, my initials, and the time of day I gave it, the route, and the medication given. Okay. So then I'm going to prime my tubing. The tubing is intact and it's labeled and it's not expired. And I'm going to prime it. You're still using aseptic technique. I'm just going to clean this off anyways. Alright. And prime it a little bit. Alright, that's primed. Alright, and then also I will apply an alligator clamp, a needleless device to it. And then I'm going to also label the tubing with the date and the time and my initials as well. And then over here I'm going to, draw up 6 milliliters of saline. I'm going to attach a needle, clean the top of the saline, which is in date and intact. Draw that up. Part of the ASASH technique. And then I'm also going to discard of this properly in the sharps container and apply a needleless device, the alligator clamp. Alright, then I'm going to take my Ma in the room with me and all these supplies. Knock, knock.
Hello.
Hello, how are you?
Good, how are you doing?
I'm great, thank you for asking. Well, my name is Megan, I will be a nurse today. Can you tell me your name and date of birth?
Leslie Peoples, 9984.
Patient is incoherent. Alright, so I wouldn't have touched her. This is the correct patient, and this is the correct armband, so this is the correct patient. Alright, Miss Leslie, I'm going to give you some medication through your IV, okay?
Okay.
You need an antibiotic or an anti-infective medicine given.
Okay.
I'm going to wash my hands, apply clean gloves, And I'm going to ensure or check the site for patency if there's any infiltration or phlebitis. There is not. This is a good site. I'm going to clamp it and administer. Oh, I'm sorry. Take an alcohol prep pad, clean the port. And then I'm going to hook it up and aspirate for blood return, which I did, and then administer 3 milliliters using the push-stop method. Oh, I'm sorry, I'm going to unclamp this. And then administer 3 milliliters using the push-stop method. Push half milliliter, stop, push a half milliliter, stop, until I've administered the full 3 milliliters, which I did. All right, I'm going to clamp this to maintain positive pressure. And then I'm going to hang the bag. And real quick, Miss Leslie, do you have any allergies?
No.
Okay. Make sure that's right. And I'm going to establish a flow rate of 33 drops every 30 minutes. All right, and this alligator clamp has a cap on it, so it's very clean. I'm going to hook this up. And this would be a good time to teach Miss Leslie about the signs and symptoms of anaphylaxis or a reaction to the medicine. So I'm going to unclamp this as well and let it flow. And it's going all over the place, but it's flowing. All right. All right, and I'm going to dispose of everything properly. This is all new equipment on this board now. So I'm basically going to take off these gloves, wash my hands. Ms. Leslie knows that the signs and symptoms of anaphylaxis and allergic reaction, and she knows to call me when I'm not in her room if anything happens. I'll wash my hands. Call me if you need me, Miss Leslie, okay?
Okay.
Okay. And I'm going to dispose of that properly. I come outside. I'm going to check on the patient periodically to check for anaphylaxis and an allergic reaction. And then I will come back into the room.
Come in.
All right, I'm going to hand sanitize my hands. All right, so it looks like it's been about 30 minutes. Your medication's already been given to you. How do you feel?
I'm good.
All right, good. I'm going to wash my hands, apply clean gloves. And I also have a new syringe of saline that I brought in with me. Saline. All right, I'm going to clamp this. This is already done. And clamp the IV side as well to maintain positive pressure. I'm going to hang this back up and apply a new alligator clamp for the new medication that's going to be given. Hang that up there. All right. Oops. I'm going to wipe this